Welcome to the second of 3 presentations about mentation, one of the 4 M's in age-friendly care. In this presentation, we'll focus on the signs and symptoms of depression and the important roles of daily caregivers in providing age-friendly care to older adults who may experience depression in nursing home and other long-term care settings. As we have said before, daily caregivers make a big difference in the quality of life and living of older people in their care by using the age-friendly framework. There are many opportunities to talk with older adults as you provide assistance with daily cares. Talking to the person about their life, interest, and care preferences can help you learn what matters to them, and in turn, you can help the person do what is enjoyable or important. When daily caregivers focus on quality of life for residents, they greatly increase the chances of improving their own quality of work life. In so many different ways, what is good for the resident is also good for daily caregivers. Today, we're going to talk about depression, which is the second part of mentation in the age-friendly framework. The first step in helping a person with depression get the help they need and deserve is to notice changes in behavior and hear expressions of sadness, hopelessness, and despair. But we have to stop ourselves from saying, "Oh, that's natural," or "Gee, I sure understand how you feel," and then doing nothing more. Being age-friendly means we take the next step to support the person, and that requires understanding depression as an illness, not just passing feelings or being sad or blue. Depression causes a wide variety of changes in mood and behavior, including physical health problems. However, one of 2 symptoms must be present to make a diagnosis of depression: depressed mood or loss of ability to experience pleasure, which is also called anhedonia. Depressed mood often includes deep feelings of sadness, discouragement, and crying spells or tearfulness. Older adults may not say "I'm depressed." Instead, you may hear comments like feeling down in the dumps or having the blues. The person can also be depressed without having a depressed mood. Instead, the person has anhedonia, which is the loss of ability to experience pleasure in activities that are normally enjoyed. As a result, the person often withdraws from his or her usual activities and increasingly becomes inactive. When you urge them to participate, they say things like, "I don't care," that nothing is fun, it isn't important, or that they just don't care anymore. Their withdrawal, apathy, and indifference represents loss of ability to experience pleasure. The medical diagnosis of depression also includes physical health problems and psychomotor changes, which is the speed of their response, both physical and mental. Some are slowed down, others may be agitated or restless. Depression also makes people feel bad about themselves, like they are worthless or no good, and guilty without reasons. Their concentration can be impaired, which can make them look like they have dementia, and thoughts about death and suicide, that life isn't worth living and they would be better off dead, are part of depression. These changes all interfere with the person doing what matters most. Indifference, apathy, lack of energy, and interest interfere with both self-care activities and doing things that are enjoyable. Signs and symptoms of depression often start over a 2-week period of time and then persist for months or even years if not treated. Loss and life stress often trigger depression. Loss of loved one to death or relocation, changes in health or function that cause fear or distress, moving to a new and unfamiliar living situation, pain that interferes with doing what matters. There are many forms of stress that can contribute to depression, and for other people, depression is part of their biology and seems to come from nowhere. As before, there are 2 main steps in age-friendly care. First, ask yourself if the person has experienced a recent stress or loss that might be causing the behaviors you see, like sounding down or blue, not caring, being hard to motivate or get going. Think about the changes in mood, physical health, and thinking that are part of depression, you can also look at the chart for history of depression and the minimum data set, or MDS, in nursing home care include a depression rating scale. Asking the person directly also helps and can be done as part of checking on what matters in daily care. Next, act on your findings. Daily caregivers have many opportunities to help the older person engage in self-care activities to address physical issues that are a part of depression. Talking, listening, and encouraging activities that have antidepressant effects makes a big difference. Documenting what you observe and talking to your team about approaches helps assure the person gets the care and treatment they need. Although it may be tempting to try to cheer the person up, it is important to avoid. Listening and being caring, non-judgmental, and accepting is more helpful. Their feelings are real to them, and saying they shouldn't feel that way often makes them feel worse. The same is true for oversimplified reassurances like, "It's not that bad," or "Try to look on the bright side," and correcting misbeliefs about depression or other problems. It's tempting to say, "That's not true," or "Things aren't that bad," but a stronger approach is to listen and say you care. "I'm sorry you feel bad right now. I hope we can do something together that helps you feel better." Shifting to what matters or what might make this day brighter can help. Physical health problems are both caused by depression and contribute to functional decline and disability. If the person doesn't feel physically well, they're unlikely to engage in activities that might help them feel better. Daily caregivers have many opportunities to promote health and reduce illness-related problems. Paying attention to factors that are part of depression and that can contribute to feeling better or worse is important. Working with your team to figure out how to best address problems is critical. Scheduling pleasant activities and events, just like medical appointments, is called behavioral activation, or more simply, getting active. The point is to help people with depression reestablish healthy routines, increase positive experiences, and overcome avoidance patterns. Scheduling pleasant social and physical activities leads to improved mood and better functioning. Activities are often best provided one-on-one or in small groups. Using what matters to guide activity selection and working with the team members in the activity or recreation department really helps. Starting with something simple and doable reduces the risk that not following through makes the person feel worse. Work on being failure-free. Respond to, "See, I can't do anything right," with, "I disagree. That just wasn't the activity for you. Let's try something else." Daily caregivers can also support engagement in physical exercise and activities. This fits well with mobility, which is one of the 4 M's, and urges older persons to engage in some physical activity each day. Research shows physical activity for 20 minutes a day, 5 days a week, is associated with decreased depression and improved health. As before, keeping the activity simple and doable is important. For example, chair exercises may be a good starting point. Another research fact is that people who are involved in social activities at least 2 times each week have less depression than those who are not engaged in social activities. In short, there are many strong reasons to collaborate with your team to use physical and social activities for their antidepressant effect. Activity engagement helps break down the cycle of "the less I do, the worse I feel," and everyone can help make sure it happens. In summary, daily care providers have many important roles in both identifying older adults who are experiencing depression and adjusting their approach and routines to promote wellness and recovery from depression. Promoting engagement in simple yet doable physical and social activities, working with team members in the activity or recreational department, and supporting the person to do what matters most helps relieve depression symptoms for the person and build your relationship with the resident and team. Next, I hope you listen to the What Matters podcast to hear about how age-friendly care positively affects residents, caregivers, and even nursing professionals.